This presentation is an outline of my therapy approach, and this outline is intended to be an example of how your counseling theory might translate to practical application in the counseling relationship. It's not intended to lead to a how-to approach, but rather serve as a reference for giving direction to the therapy process. So think of it more as a tour guidebook with suggestions, but not telling you definitely that you have to follow step A, step B, step C, or step C, even though it's going to be presented in that type of form. In working with clients, I generally follow 4 phases. Phase 1 is the establishment of relationship. Next comes exploring and understanding the individual's dynamics. Third, point C, encouraging insight on the part of the client. And fourth, reorientation and re-education. My primary goal in working with clients can be summarized as trying to arouse the client's social interest or sense of commonality with all humans, and to discover the need for cooperation with other people. Cooperation forming the basis of successful family relationships. As with any summary, in making a thesis statement like that, it's necessarily reductionistic, but the statement does provide a focal point so that I can point my work in a particular direction, which then guides the more individual or minute steps along the way. During the establishment of relationship phase, I'll point out 7 steps that make up this phase. The first is to work with the client in such a way that it becomes clear to the client that it is a collaborative process, one in which they sense they have an increasing sense of responsibility for their own life. So the first point is that it's collaborative. Second, the basis for the relationship, of course, is empathy that the counselor communicates to the client. Sense of caring, this is involvement. Counselor congruence that we've talked about at other points during the semester in CNS 509. Carl Rogers' unconditional positive regard, and the main point being accurate, empathic understanding, and friendship. The third point is that during the initial phase of the relationship, most of the skills that the counselor uses are what we have referred to in CNS 501 as attending and listening skills. And this, of course, communicates to the client the empathy that we're emphasizing in point 2. Fourth, and this is taking off to a degree from collaborative, that the client begins to see this as a partnership in which both parties are working together for the good of the client. The 5th point is that goals between myself and the client need to be agreed upon, and this emphasizes the partnership. So they need to be agreed upon, and they also need to be clear and measurable. I'd encourage you to Google the concept of SMART goals to help you understand agreed upon and clear goals. The 6th point is that the counseling work that I do, in addition to emphasizing what we talk about as pathology, focuses not just on those liabilities, but also on what strengths that the client has. What you'll find is that clients utilize their strengths to overcome their weaknesses, so that we have to take into consideration what assets the client brings to the table. The 7th point is that the counselor uses encouragement with the client to get the client to utilize their strengths and assets, that to help them pull together their resources to address their liabilities. For example, something like stubbornness may be then funneled into determination. So stubbornness, which might be seen as a liability, can be seen possibly as a resource and then used to benefit the client. The next phase of exploring and understanding the individual's dynamics, I break into 4 sections. First of all, the point of this process is to understand the lifestyle, which is a critical Adlerian concept, and I won't go into it here. If you're interested, I encourage further reading. The lifestyle is an Adlerian concept that affects the client's current functioning. And so the second point is that this exploring and understanding the individual's dynamics can be thought of as essentially an assessment section where the counselor is working in a collaborative relationship with the client and in partnership to understand the lifestyle and assess how it's impacting the client's life. So the client and the counselor are looking at 3 key things. They are looking at beliefs, they are looking at perceptions, which is a very crucial concept with Adler. You may remember Adler once stated that perceptions, in fact, are reality for the clients. And then third, something that we talk about from many theoretical viewpoints, is the feelings of the clients. And then fourth, this analysis and assessment may be thought of essentially as what is called resulting in a lifestyle assessment. And the lifestyle assessment takes into consideration the following things. It takes into consideration the family constellation, birth order, early recollections, dreams the client has, their current life tasks, their priorities, how they are best encouraged, and their chosen methods of meeting needs. Again, it's family constellation, birth order, early recollections, dreams, current life tasks, priorities, the encouragement process, and how the client is best encouraged, and then the chosen methods that the client utilizes of meeting their needs. The third phase is referred to as encouraging insight, and during this third phase there's 4 main dynamics that are at work. The first is, during this third phase, the counselor moves towards becoming more confrontational with the client. Now, this confrontational nature is designed to challenge the client to develop insights into their mistaken goals and their self-defeating behaviors, so that we're taking the lifestyle assessment and we're turning it into insight for the client. The second piece is that a major goal of the counseling is to help the client understand what essentially their number one priority is. For example, for the dependent client, the number one priority may be to meet my needs by taking care of other people, and to accept it and to decide whether or not the price they're paying for meeting that number one priority is really worth it. The third thing is to help the client see that to a great extent we essentially choose our behavior and are responsible for what we do what we think and what we feel. And here's where Adlerian theory crosses over and melds well with William Glasser's choice theory in his book Reality Therapy, which I encourage you to look at if you haven't. And then fourth, the insight that is being gained. The counselor is hoping to see this insight emerge in three different ways. First of all, it can emerge through using true encouragement. And remember the difference between encouragement and praise. You're noticing what the client is thinking and feeling, and this is true encouragement from an Adlerian perspective. Second, the counselor is challenging the client. And then third, the counselor is working on interpretations with the client. As the client is talking about their dynamics, their family history, etc., there are interpretations to these stories that are being given that we're working collaboratively to understand. The final phase is one of reorientation and re-education, and this phase has 6 different dynamics to it. The first is the phase helps people focus on seeing what may end up being for them more functional alternatives to the self-defeating behaviors that they have been engaging in. And secondly, these alternatives are explored, and the implications of the alternatives and the cost of making these alternatives become real behaviors are assessed. And remember to explore the client's ambivalence about making the changes, because with every change comes some gains and some losses. Third, the counselor helps the client see their increasing responsibility for ultimately making these changes. Fourth, these new orientations toward people and life tasks then affect what we just talked about in the last step in terms of changes to client beliefs, changes to their feelings, and changes to their goals as the alternative behaviors are considered and implemented. Fifth, failure to progress is viewed as the mistaken purpose and payoff to continue the self-defeating behaviors. The cost of change is, of course, great, and the previous behaviors had some benefit to them, and so the client may actually continue in those self-defeating behaviors as they face the cost of change. And then sixth, different methods are employed to solidify the gains during this stage, and so I'll just list off a few of them here. The use of immediacy, talking about what's going on at the present moment. Using paradoxical intention, where you actually argue for the self-defeating behavior to see if the client can argue for or behave differently. The concept of acting as if, Glasser referred to faking it until you make it. You imagine the way that you would like to be and act as if that was true, and it can actually become habit. Another one, an Adlerian technique, is called spitting in the client's soup. If somebody spits in your soup, you no longer think it's tasteful. The therapist determines the payoff of some of the behavior and then spoils it by reducing the usefulness of the behavior in front of the client's eyes by talking about the cost of those self-defeating behaviors. The counselor tries to increase the client's ability to catch oneself. This is based in self-awareness as they become aware of the destructive behavior and the irrational thought. They do it under the coaching of the therapist in order to avoid self-condemnation. And so those techniques are used to help during the reorientation and reeducation. And again, this is to lead to the primary goal that I mentioned earlier, to arouse the patient's social interest or sense of commonness with all fellow humans, and the need for cooperation in the family, which is a microcosm of the community, and then ultimately cooperation is what makes our communities function. So that is a very quick, less than 16-minute summary of my personal therapeutic approach. I actually have this in an outline form, and I do keep a copy of this somewhere near where my working desk is at the counseling office, and I will on occasion pull it out, look it over, and it's just like a roadmap that helps me stay on the path of therapy with each client, as opposed to getting into socialization or hitting lulls or plateaus with clients. Thanks for listening to this.